A pharmacist's job from an outsider's point of view looks rather simple. For a patient's perspective, what they see is a pharmacist taking their piece of paper with their written prescription, type the information from the piece of paper into a computer, then later handing their patient their medication, approximately 15 minutes later. Why does it take this long? All the pharmacists have to do is smack a label onto a vial of pills and then hand it to the patient, right? There's actually a lot more that happens behind the counter at a pharmacy than the general public sees. The pharmacist isn't a regular worker wearing a white coat. He or she is in fact a very intelligent and persistent human being that had to go through years of hard schooling to get to the position they are at today, to provide you with the medication you need. This video will be explaining everything you should know before pursuing becoming a pharmacist, in about 5 minutes. From what exactly a pharmacist is and what they do, to the education required, as well as some extra information at the end, showcasing a realistic view of what being a pharmacist is like. To start off, a pharmacist is a healthcare worker whose job is to decipher, fill, and log prescriptions written by doctors received from patients. They overlook a patient's prescription record to make sure whatever medication the doctor prescribed has the correct dose for the age and weight, and does not conflict with what the patient is currently taking or taken in the past. Lastly, the pharmacist will counsel the patient on how to take the medication, and other general health topics. So the reason your medication is taking 15 minutes or longer to be dispensed is because of all these steps your medication has to go through before becoming a label stuck onto a vial. Moving on, it's time to look at what kind of education is required for someone to become a pharmacist. A general overview on the amount of schooling required is 2 years of studying under general sciences, and later 4 years of pharmacy school. Together, this means it should take a student 6 years to become a pharmacist. However, realistically, nowadays it takes at least 7 to 8 years. The reason for this is because of the amount of complex material prospective pharmacists have to learn, mostly in the third year of pharmacy school, the most challenging year. To give a sneak peek on what you would learn in the third year is where you will look at the specific classings for each drug as well as how to organize them. The prerequisites required to get into pharmacy school differ depending on the university you go to. For the sake of convenience, I'll be focusing on the prereqs the University of British Columbia require, since personally I plan to go to that university. If you plan on going to the University of Toronto, these prerequisites will apply as well. Before getting admitted to pharmacy school, you'll need 2 semesters of first-year biology, chemistry, calculus, and social sciences, 1 semester of first-year English, writing along with 1 year of English at any level, 1 semester of second-year cell biology, organic chemistry, microbiology, and lastly, introductory statistics. After you graduate, as a working pharmacist, you will be required to do 15 hours of continued education every year to freshen up your pharmacology knowledge and keep things up to date. Now let's look into the career details. To get an official license, prospective pharmacists in Canada must pass 2 exams, the Pharmaceutical Examination Board of Canada, which tests for pharmacy skills and knowledge, and the Provincial Jurisprudence Exam. This exam differs between provinces. A pharmacist's annual salary and wage depends mostly on what company they plan to work under. For example, Shoppers Drug Mart pharmacists have a wage of $37.60 to $51.76 per hour, and an annual salary of $54,000 to $75,000. On average, pharmacists would work at least 28 hours a week, 8 hours per shift. Before you plan on pursuing pharmacy, it is really important that you're aware of the workplace hazards pharmacies have to offer. As a pharmacist, you'll constantly be exposed to patients with all kinds of health. Something most people don't realize is, pharmacists are first-line workers during immunizations and pandemics. During pandemics, it's their job to provide medications to everyone, including the ill. Next are chemical hazards. As a pharmacist, you'll be working with cytotoxic drugs. Cytotoxic drugs can affect a person's health if constantly exposed to it. For example, cytotoxic drugs can even cause cancer. A huge hazard that is very common in most pharmacies are robberies. Since pharmacies tend to carry very expensive street drugs, they are prime targets for robberies to occur. Retail pharmacies can also contain medical devices that too are very expensive, thus prime locations for robberies to occur. Lastly, a workplace hazard that represents the reality of working in pharmacy is disrespect. Even though pharmacists are frontline health workers, they receive little respect from the public. Pharmacists carry all the medication records for each patient, so they can provide the best health service to patients as they possibly can. Most customers tend to see pharmacists merely as pill counters, even though their jobs hold much more responsibility. Before you plan on pursuing pharmacy, it is important to be aware that once you become a pharmacist, you'll be dealing with many customers who view you simply as a distributor and not a health worker. Let's review and summarize the most important notes taken from this video. It is the pharmacist's job to ensure the quality and safety of every medication they dispense to the public, ensure the medication is suitable for each patient's conditions, ensure the correct medication is distributed to the patient, and provide counseling for patients on how to take their medication. Prospective pharmacists go through a minimum of 6 years of post-secondary education. They get paid a wage between $37 to $51 per hour and work at least 28 hours per week, 8 hours or more per shift. As a pharmacist, you'll be exposed to the public and put at a higher risk of getting sick. Lastly, the most important thing to remember is what makes a successful pharmacist is not the work ethic, but the compassion. Becoming a pharmacist requires a lot of patience and work. You cannot become a pharmacist unless you have the passion to care for all sorts of patients and willing to risk yourself to provide the best care for the public.